The lower eyelid skin pinch. This is an incredibly common request, and it's one of the most common indications for people coming to my clinic where I actually say no to the surgery. And it's really important to explain what the lower eyelid skin pinch is for and why you would consider having it, and when to consider having it alone and when to consider having it with another procedure like a canthopexy or a canthoplasty. So what is the skin pinch? Now, ultimately, this is one of the most traditional, one of the most historic forms of lower eyelid blepharoplasty, and it's to pinch a bit of that skin on the lower lid and remove a tiny bit of that skin. The scar is hidden just under the lashes, and that's called a subciliary incision, and it can be done under a local anesthetic, which makes it quite attractive. Now, typically, people will come in and say, if only I looked like this, and they'll stretch their eyelid just like that. But what you have to realize is that the eyelid is like a hammock, and the hammock is secured from the lateral canthus, so that outer corner there, and the inner or the medial canthus, and that inner corner there. And between it, that needs to be under no tension. So your eyelid cannot be under any tension. If too much skin is removed in this area, what will happen is that hammock will then drop centrally, and that's called lower eyelid retraction. And that's one of the complications that we do sometimes see, and it's what you really want to try and avoid. So when to consider a skin pinch? You need to consider a skin pinch if there is an additional fold of skin that is present onto the lower eyelid. And if you were to pinch that skin, that eyelid fold would remain there, then you are probably suitable for a skin pinch. There are things in terms of the eyeball position relative to the eyelid which would make you more or less suitable, but those would need to be assessed by an oculoplastic surgeon. So it's best to probably see somebody if you have a fold of skin to discuss what your options are. Now, you can have a lower eyelid skin pinch alone if there is very minimal or no lower eyelid laxity, because when the skin is taken away and the muscle underneath is preserved, and it's quite important to preserve the muscle underneath to also reduce the risk of retraction, and the eyelid is nice and tight, then it will stay in the right position. If, as we get older, we have a bit of laxity, we also get that laxity in our eyelids, that laxity might then need to be addressed if you're having a skin pinch, and that can be addressed with a canthopexy. And I typically think of a canthopexy as where the eyelid or the outer corner, the canthus, is augmented but isn't tied and isn't reformed, and so that's when it's tightened in this way, or a canthoplasty where the eyelid is shortened and that corner is refashioned, and that's called a canthoplasty. We would consider those if there is some eyelid laxity there that needs to be addressed for you to have a successful skin pinch. And also, bear in mind that this isn't a one-size-fits-all. Lower eyelid blepharoplasty is far more specialized, and you need to see an oculoplastic surgeon, somebody who is familiar with the different procedures, so that you know you're going in for the right thing.